Exposures to blood and other body fluids occur across a wide variety of occupations. Healthcare workers, emergency response and public safety personnel, and other workers can be exposed to blood through needle stick and other sharp injuries, mucous membrane, and skin exposures. It's also possible to be exposed in your industry. The pathogens of primary concern are the human immunodeficiency virus HIV, hepatitis B virus HBV, and hepatitis C virus HCV. These viruses cause diseases that can lead to death. Now, we're not trying to scare you. We're trying to make you realize the importance of the procedures outlined in this program. By following these procedures, you'll dramatically reduce your chance of being exposed to or infected with these deadly viruses. They're called blood-borne pathogens because exposure usually occurs from contact with blood, but not always. Other body fluids can contain these viruses as well. The first rule is to remember, treat all blood and body fluids as if they are contaminated. Don't take chances. Serious diseases require serious attention. Your employer must provide access to your company's blood-borne pathogens exposure plan. If you want or need more information about this plan, ask your supervisor. An occupational exposure refers to an exposure that may occur during the performance of your regular job duties. The industry you are in and the job duties you perform may result in an occupational exposure. Contaminated needles, broken glass, blood, or other hazards may be present in your work area. Regardless of the hazard, you need to take steps to prevent exposure. But remember, everyone on site isn't trained to respond to every blood-borne pathogen's exposure. You should never take a chance or guess when your health and safety are involved. There are trained personnel on property who are authorized to handle larger exposures. If you are unsure, ask your supervisor. Again, don't take a chance. But there are things you can do to protect yourself regardless of the situation. Always wear rubber or latex gloves when handling used linen or cleaning the bathroom. It's good policy to wear them during the entire room cleaning process. Even if there are no visible potential blood-borne pathogen exposures, these gloves will help protect you. Always discard the gloves after use or after a contamination incident. Here's a proper way to remove latex or rubber gloves. As you can see, you must remove gloves in this way to prevent your unprotected skin from contacting the outside or contaminated portion of the gloves. After removing the gloves, wash your hands with an antibacterial soap. Washing your hands frequently throughout the day will also help prevent exposure. Some other tips to help you avoid an exposure incident are: never reach your hand into a trash can. Remove the contents by lifting out the bag or liner. Sharp items may be poking through the bag. Always be prepared when handling clothing, towels, bedding, or linen. There may be sharp objects present that you cannot see. An improperly discarded needle or contaminated glass could be hidden in sheets or a towel. Beware. Sheets, bedspreads, towels, or linens contaminated with blood or other body fluids should be handled with care. When handling filled biohazard bags, use caution. Never use your hands to support the bottom of the trash liner or biohazard bag. Always carry the bags from the top and keep them away from your legs while walking. All contaminated waste must be placed in closable, leak-proof biohazard containers. Do not overfill these containers. These items must never be thrown in the regular trash. An authorized service is authorized for biohazard removal. If you find contaminated sharp objects such as broken glass, notify your supervisor. They will advise you how to proceed. Never handle broken glass with your bare hands. Use tongs or a broom and dustpan to pick up the glass. Place the broken glass in a sharps container or other approved location. If you find a hypodermic needle, beware. These items should also never be touched by your bare hands. Use tongs and dispose of the needle in a sharps container. Sharps containers must be stored out of the reach of the public and in a location where the shortest person in the area can see the top of the container. This prevents a blind spot at the top of the container where sharps could possibly be sticking out, exposing someone to cuts or needle stick injuries. Otherwise, they must be stored in a locked closet. If you ever have any questions about what PPE to wear to prevent an exposure incident, stop what you are doing and ask your supervisor. Remember, everyone is not authorized to respond to everything. There are designated personnel on your property trained to respond to larger exposures. There is more PPE required for these types of exposures. Items such as an apron and shoe covers are suggested, in addition to gloves. An absorbent material should be sprinkled onto any blood present and be allowed to stand for at least 1 minute. Make sure you cover the entire affected area. Once the blood has become gel, remove it safely and place it in the biohazard trash bag. Ensure that contaminated materials touch only the inside of the bag. Then disinfect the contaminated area. Spray approved disinfectant and let it stand for the length of time advised on the label. After wiping up, place towels, any other contaminated items, and the red biohazard bag with the gelled blood inside another red biohazard bag. Then place your gloves inside as well. Remember, remove your gloves without touching the outside exposed surface. The biohazard bag must be disposed of properly. Then wash your hands, wrists, and arms vigorously with an antimicrobial hand wash. But it's not just guests. Employees may experience injuries as well that result in bleeding. Generally, minor first aid procedures such as those administered for small cuts or abrasions require only rubber or latex gloves for protection. But again, larger exposures must be handled by trained and authorized personnel. Proper PPE? Check. Proper absorbent? Check. All blood cleaned up and in a biohazard bag? That biohazard bag placed into another? Check. Area disinfected? Check. All other contaminated items in the second biohazard bag? Check. We always need to be prepared for potential hazards, and by doing so, we can minimize risk. But what is the procedure if you do experience an exposure incident such as a needle stick, contamination of the mouth, eye, mucous membrane, or other puncture of the skin? First, wash the exposed area with water. Report it to your supervisor immediately and seek medical attention as quickly as possible. Fast action is the key to prevention. Post-exposure evaluation and follow-up programs will be made available to you should you be exposed to bloodborne pathogens. Medical records are confidential and only certain information may be provided to your employer. At no time will the results of any testing or other medical evaluation be reported to your employer. Your doctor will discuss all pertinent evaluations, any diagnosis with you. Your rights and confidentiality are protected. It's your responsibility to follow your company's rules and exercise good judgment when handling laundry, clothing, or working any contaminated surface or area. Follow the rules. Wear the required personal protective equipment. Take a personal responsibility for safety and do your part. If you want more information regarding bloodborne pathogens or how to prevent an exposure incident, ask your supervisor. They'll be glad to help. Thank you.